Second, the number of different cells: red blood cells, erythrocytes, white blood cells, leukocytes, and platelets. Platelets known as thrombocyte. 4, the volume of cells. And 3 and then 4. Now is the 4. The erythrocyte sedimentation rate, known as ESR, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. Part B, anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the diet is lacking or deficient in iron, known as Fe. A medical study has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. We have now a little conversation with the patient and his professor. Let's begin. Professor says, what's the most likely diagnosis in his case? Student, most probably carcinoma of the bowel with chronic blood loss. Professor, what's against that as diagnosis? Well, he hasn't had any change in his bowel habit or lost weight. What else would you include in the differential diagnosis or of severe anemia in a man of his age? He might have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another case is iron deficiency, but he seems to have an adequate diet. Okay, now there's another cause of anemia which I think it's more likely. Chronic bleeding ulcer? Yes, that's right. But what about pernicious anemia? Can you exclude that? Well, he's got none of the typical neurological symptoms like paresthesia. And it was all. Now, part C, pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his textbook. It says, pernicious anemia, known as PA, is a condition in which there is an atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious, with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue or glossitis is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. We have here a couple works along with the text. It says onset means beginning, insidious, slow or developing, pallor, lack of color, mild, slight, jaundice is bilirubinemia, breakdown, division into smaller parts, bone marrow, soft tissue in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibrations, progressive, continuing to develop, palpable, can be felt with the hand. We have finished with this side, blood. It's now the turn to read the blood section of exercises. It says, exercise 14.1. Find words in the box with opposite meanings. Look at B and C opposite to help you. I'm going to be reading how I did it, as I think is the opposite meaning. For example, we have adequate. For me, is inadequate. Against, we have for. Unlikely, common, severe, mild, mild, severe, rare, common, common, rare, sudden, insidious, insidious, sudden, inadequate, adequate, for, against, and likely, unlikely. It was how I completed. Exercise 15.2. Make word combinations using a word from each box. Look at V and Z opposite to help you. Here we have a little thing that we need to complete, and I'm going to be saying it. We have bone marrow. Differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing, vibration sense. We have exercise 15.3. Complete the sentences. Look at A, B, and Z opposite to help you. First one. A 39-year-old man presented with a history of insidious onset abdominal distension over a period of 6 months. Number 2. Blindness may be caused by vitamin A, platelet deficiency. Vitamin A, platelet deficiency. Number 3. The bleeding and purpura are caused by abnormal platelet function. Number 4. The white cell count is normal, so we can exclude acute leukemia. Number 5. The yellow color of her skin and conjunctivitis is probably due to jaundice. Number 6. There was a palpable mass in the right upper quadrant of the abdomen. Number 7. Treatment is aimed at restoring fluid balance with fluids, intravenous fluids. 8. The anemia may be due to increased red cell destruction. Exercise 15.4. Complete the conversations. Look at C opposite to help you. We have a little conversation within professor and student. Professor starting says, what is against the diagnosis of pernicious anemia or physical examination? The patient says, the problem started quite suddenly, so I didn't have the typical sudden onset. He doesn't have any skin pallor, and he doesn't have paresthesia or absent vibration sense, and I couldn't feel his spleen. Professor said, what about his tone? And the student says, his tone was normal and not inflamed or sore. We have finished on this side. It's now the turn to read the part 16. This is called bones. We're gonna be reading either exercises and the theory of this side. Okay, it says bones, part 8, bones. Some common English name for bones. English name and anatomical name. English name is skull, jawbone, spine, breastbone, rib, collarbone, shoulder blade, thigh bone, kneecap, and shin bone. And anatomical name, we have cranium, mandible, vertebral column, sternum, costa, clavicle, scapula, femur, patella, and tibia. Part B, fractures. Fracture is a break in a bone. Some of the different types of fracture are, let's see, green stick, displaced, committed, impacted, open or compound. A pathological fracture is fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma, for example, long distance marching or running. Part C, treatment of fractures. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a splint or plaster of Paris cast, or internal, for example, a pane or a plate and screws. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. We have finished with this now. Note, the verb reduce has several meanings in medicine. For example, to make it smaller, I think we'd better reduce the dose of your tablets. In surgery, to return to anatomical position, a hernia can normally be reduced by manipulation. And in chemistry, to remove oxygen or add hydrogen. Nitric acid is a reducing agent. We have a plaster cast, a pate, and a plate and screws. We have finished this side. It's now the turn for exercise 4 part 16 called bones. We have the exercise 16.1. We're gonna be seeing now. You're gonna be seeing this now.